So here's how to do the chin tuck in an upright position, obviously a little bit more functional. So it's the same kind of rules. I'm going to retract slightly, and it's upper cervical flexion. Now be careful of this move. This is what patients do all the time. They sort of extend in the lower cervical spine versus sort of lengthening and elongating. So a couple of cues that I give people, as I say, imagine there's a string here in the back of your head, and it's pulling sort of up and backwards a little bit, so people can sort of get that motion versus that motion. So it's really sort of elongating with the upper cervical flexion. So what I often do is use the wall as a cue, especially to start. So I get my feet out in front of me a little bit. And one little trick too, this adds that little bit of thoracic extension activation. So you can see right now, if you look at the top of my thoracic spine, my CT junction is probably about an inch or two away from the wall. So what I'm going to first have the patient do is sort of soften that curve up a little bit. I'm not adding lordosis in my lumbar spine. So if they're doing this thing, that's not really correct. So maybe you give them a cue to brace their abdomen, and they're going to flatten out the thoracic spine, and the back of my head starts to touch the wall. And now from here, I'm doing my chin tuck. Now again, doing these exercises doesn't mean you're having them walk around for the rest of their life that way. It's a good exercise to do while they're at the office during the day, just to sort of remind them to not drift into that extreme bad posture and sort of live somewhere in the middle. It's an activation, it's a little bit of a lengthening, a stretch. It all depends on what the patient's impairments are, but using the wall is a good place to start so that they sort of get the idea, and then eventually remove the wall and see if they can do a similar motion without it. And the last thing we'll say for now is, as you're teaching your patient this positioning, similar to what we did in supine, you can have them then add upper extremity motion. When you're practicing this, you'll be surprised at how you feel work developing in those deep cervical flexor muscles as I'm adding upper extremity motion. Again, similar to before, you can get creative with it, but just practice with the basics first.